So let's start second part, which is fundus, fluorescein, angiography. So today we're going to discuss about the procedure. So basic stuff, how blood flows and all this stuff, what are the equipments and all this stuff. Okay. So basically, let's move from the equipment and material needed for the angiography. So basically, fundus camera, which is an auxiliary equipment, definitely the best fundus camera, and definitely that fundus camera matched fluorescein and filter, barrier and exciter, and digital photo processing unit, which is basically computer based. These are all set up in one setup. 23 gauge scalp, basic fine needle is needed, 5 ml series is needed, and 5 ml of 10% or 3 ml of 25% fluorescent sodium is needed. Okay, this is very commonly asked in MCQs. Okay, very commonly asked in MCQs. So 20 gauze and 1.5-inch needle to draw the dye, and basically arms for the fluorescent injection. So armrest for the fluorescent injection, and tourniquet, alcohol swipe, bandage, standard emergency equipment. If standard emergency equipment, if there is a severe any complications. So it's very important that uh, fundus fluorescent angiography is done in supervision of medical person. So what is the procedure? Patient is informed about the normal procedure and the side effect and the adverse reaction. That's very important. Patient consent and patient should be informed. It's very important. So first dilate the pupil, because after injecting the dial we have to take photograph rapidly, isn't it? So made sit comfortable. So first patient must sit comfortable, and first, without injecting dye, we have to take 3 to 4 red free photographies taken for the control purposes. Basically we have to take a raw photo. Dang, 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 finished. Okay, then 5 ml of 10% or 3 ml of 25% sodium fluorescein injected through the antecubital vein, basically in hand antecubital vein. So we waited for 8 seconds for young and 12 seconds in the older. Why? Because these are normal arm to retina time, and this is also commonly asked in the MCQ question. Okay, normal arm to retina time is basically in young older patients is 12 seconds. Since photo are taken 1 second interval for 10 seconds, means rapid die photo is taken interval, and then after 10 seconds every 2 seconds for 30 seconds. What do you mean by the every 2 second interval for 30 seconds? Eventually means 15 photos, isn't it? So then late photography is usually taken in 3, 5 and 10 minutes. Late photography, why we take late photography? Autofluorescence, isn't it? Yes, that's good. So when we inject the blood, basically sodium fluorescein, what happens in the circulation? Okay, circulations will dye. It's very important. First we inject the dye in peripheral vein, which is antecubital vein, isn't it? Then it moves to venous circulation. Yes, from venous circulation it moves to heart, and from heart then only it moves to arterial system, and from arterial system it moves to which artery? Obviously internal carotid artery. Why? From internal carotid artery, definitely ophthalmic artery is a branch of internal carotid artery. And from ophthalmic artery there is two things happen. One circulation is from short posterior ciliary artery. What is fascinating about short posterior ciliary artery? Because it supplies to choroidal circulation. And another is central retinal artery, which supplies to retinal circulations. And remember, note by the choroidal filling is 1 second prior to the retinal filling, because this is faster, short posterior ciliary artery, and that's why choroidal filling is 1 second prior to retinal filling, and obviously choroid diffusion too. So what are the normal phase of FFA? What are the normal phase of early phase, mid phase and late phase? Okay, so early phase, which is describing that long early phase, first choroidal uh, phase, in which pre-artery phase, means artery is not fused but choroidal blood vessels you can see dyes there, and then artery phase. Okay, first you fill in artery, and then from artery to vein it moves. Okay, it's called arteriovenous, that is capillary phase. And then the venous phase again divided into three phases: early venous phase, mid venous phase, and late venous phase. Okay, fine. So that's all in total early phase. Then we come mid phase, then we come there come late phase. Okay, fine. So what it actually wanted to say is actually pre-arterial phase means choroidal phase. Okay, so there is a definitely artery and veins are joined by capillaries. So then arterial phase, okay, blood flows in artery, and then artery and venous phase. Basically, artery and venous phase mean artery is full and capillary phase gone, and then venous is started. Then venous phase where arteries are being empty. Okay, so normally 10 to 15 seconds elapse between dye injection and the arrival of dye in a short arterial, as we have studied, 12 seconds, isn't it? So it's roughly 10 to 15 seconds. That's a very rough idea if you're taken to. It's very useful whenever you are giving your exam, like MCQ exam. Okay. Then choroidal circulation precedes the retinal circulation by 1 second. Okay. So choroidal circulation definitely precedes. So transit, if dye through the retinal circulation, takes approximately 15 to 20 seconds. So basically transit. So let's discuss about early phase. Early phase means a choroidal phase or pre-arterial phase. It's choroidal means pre-arterial. So choroidal feeling through the short ciliary artery, as we know from the blood circulations. Yes, initial patchy feeling of lobules followed by diffuse bush of dye leaking out the choroidal capillaries. Why that happens? Because cilioretinal vessels and prelaminar vessels and the prelaminar optic disc capillaries feel later on. So something like that. This patchy dot 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 dot. Can you see this area? Yes. So this patchy dot dot means it's that fluorescein is seen behind the retina, isn't it? Because that's choroidal filler. So patchy feeling of the choroidal capillary lobules and basically empty retinal vessels and early retinal artery feeling are seen in this picture. So basically, choroidal feeling is earlier than the retinal arterial feeling. It's very important. So it's just like, can you see the background of this patchy feeling? That patchy feeling is known as choroidal feeling. The fact of patchy choroidal feeling. Why actually patchy choroidal feeling? It's very important, and that many times viva in, I think in my viva it's also people ask that question, from my faculty ask this question. So basically, what the fact that patchy choroidal feeling is there. So basically, is choroidal capillary has a number of lobules. The lobules feel independently from one another and giving transient patch and blotched appearance. That's the reason. What's basically choriocapillaries has number of lobules, and it's definitely choriocapillaries are more numerous fenestration than definitely retinal capillaries. Now move to the arterial phase. What in arterial phase means? Artery being filled with the dye, isn't it? It's very simple. So beginning with the first appearance of the fluorescein in the arteries, the extent until the arteries are completely filled. That's called arterial phase. So basically mean artery filling up with dyes. So posterior pole filled with the dye earlier than the periphery. So basically mean posterior pole means the pole nearby macula, isn't it? The superior branch usually fill first. Okay, so basically means this superior branch usually fill means first with this. Can you see this whitish line? And after time pass, can you see this whitish fill up is getting more and more, and finally there are a lot of all the white, all the branches of blood vessels are seeing white, isn't it? It's fluorescein filled up. So basically that. So arteriovenous phase. What is that? Arteriovenous phase, which is basically means capillary phase between artery and venous. That there is capillary. So complete filling of retinal artery and the capillaries. So that's it. It means the complete filling of artery and the capillary and early start of the venous phase. That's what arteriovenous phase. And let's see, early laminar flow in the veins in which dye are seen along the lateral wall of the vein. Means laminar flow means what? Laminar flow means it is parallel with the lateral wall of the vein. So artery are filled, capillaries are filled, and now it's early filling of the vein. So choroidal fluorescence increase its free fluorescence continue to leak from the choroid capillaries. As I have already told, choroid has leaky blood vessels, isn't it? So basically means, see, all these arteries are filled, isn't it, white? And these veins, now you can see a slight whitish hue, even if it's dark. Now slight whitish hue you can see here. It's like, yes, early filling up point. Now come to Venus point. So Venus point, we have already discussed there are three things in Venus point. Venus point, Venus phase means gradually whole diameter of vein is filled. Early phase we see a light, slight white, that slight fluorescent, and a bit larger, darker portion in vein. So now gradually the whole diameter of vein is filled with the fluorescent, and earliest seen in the peripapillary and macular region. So that's it, and divided according to the venous filling and arterial empty, early, mid, and late. So early venous phase, mid venous phase, and late venous phase is divided according to the filling of venous and emptying of arterial blood vessels. So early venous phase means arteries and capillaries are completely filled and marked laminar venous flow. Means this is arteries, white is completely filled, and early laminar flow of, what do you see? Early laminar flow, see in this vein, early laminar flow, slight white here, and black portion is still there. Mid venous phase means some veins are completely filled and some should mark laminar flow. See this vein, there is a marked laminar flow, and some veins, these veins are filled already. So that's mid venous flow. And late venous flow, all veins are completely filled up. Artery begin to empty. That's quite another thing. So the vein, can you see? It's completely white portion is vein. See, this artery is now beginning to emptying, isn't it? So that's what the case, the late venous phase. Now these all thing venous thing, these are early phase. Now come mid phase and late phase. Okay, so mid phase known as recirculation phase, 2 to 4 minutes after the injection, and vein and artery remains roughly equal in brightness at that particular phase. Just remember this, vein and arteries are equally brightness. The intensity of fluorescein diminishes slowly as fluorescein is removed from the bloodstream on the first pass through the kidney. So basically means this intensity of fluorescein slowly diminishes because fluorescein is going from blood streams, it passes through kidney. So basically kidney does its function and urination and all these things. So last what is important is late phase. What do you mean by late phase? Late phase comes after 10 to 15 minutes of dye remains in the bloodstream. So this phase demonstrates the gradual elimination of dye from the retinal and choroidal vasculature. And basic thing which is this important is staining of optic disc sclera is normal finding. Okay, this is normal, but there are other things that are not normal. Any other hyperfluorescence at that particular phase, meaning 10 to 15 minutes later, any other hyperfluorescence besides optic disc and sclera suggested the presence of abnormality. Is very important. The late phase is also very important. Okay, so late phase hyperfluorescence besides what is normal, basically sclera and optic disc. So basically means in late phase, see, can you distinguish anything from artery and veins? No, no, not at all. But can you see this leakage, white portion? So that's the leakage, isn't it, from the I think optic disc pit. So it's very important. It's not normal. Okay, so basically these are the things. So in last slide I want to talk about this. So phase of angiogram and the time in second, a rough idea, just take it as a rough idea in your brain, it's very useful. So first inject in antecubital vein, then to reach to posterior ciliary artery, what do you think? It's, I have taken it as like rough 1 second earlier, but it's rough idea. What do you take? 10 seconds? So it's completely okay. It's, you'll take it 10 seconds or 15 seconds. So it's completely okay. Then what you called choroidal phase is there. So choroidal phase is very important. It's become 1 second earlier than arterial phase, which is arterial phase is roughly in adult 10 to 12 seconds. Then arterial venous phase, then this phase comes like rapid. Okay, then the photographer technician must take photography. So like rapid, isn't it? I have already told you. So these phases are in this according to these seconds, so which is quite a speedy manner. You have to take photo. That's why you have to dilate patient earlier. And the late illumination phase is up to 10 seconds, and I have already told you the late phase is up to 10 to 15 minutes, so we have to wait till that time. So this is rough idea. Okay, it can be changed from book to book, but I think it's not that necessary because we have to take a rough idea and we have to move on. So that's the rough idea about procedure. Okay, I think that's all. These are the references, and I think piston shoes.